Welcome to Professor Orthodontics, your online classroom to learn orthodontics in simple terms. Let's begin. To understand orthodontics, think of it as a part of a chain of pearl. Each pearl over here represents a specialty in dentistry. So starting from the left corner, maybe you have pedodontics, the second periodontics, prosthodontics, and so on. And at the right corner over there, we have orthodontics. Every pearl is unique. Every specialty is unique. Now, how is orthodontics unique? Let's learn. Two unique features of orthodontics is the science of biomechanics and the duration of treatment. Biomechanics basically refers to laws of mechanics that can be applied and which have to be followed for teeth to move under orthodontic forces. Not just the tooth, but also the attached bone and the periodontium responds to orthodontic forces by following the rules of biomechanics. The second feature that makes orthodontic treatment different is the duration of treatment. So it takes longer than the other specialties to actively treat a patient for an orthodontic problem. On an average, it needs 1.5 to 2 years. So let's define orthodontics. Over here, we have the definition given by British Society of Orthodontics. If we divide the definition into the first half and second half, we can understand the definition and memorize it better. The first half refers to diagnosis in orthodontic patients. The second half refers to the kind of treatment that you can bring about in an orthodontic patient. So over here we can see the word study of growth and development of the jaws and face particularly and the body generally. The second half is talking about treatment. How is it talking about treatment? Well, orthodontic treatment can be of three types. It could be preventive, interceptive or corrective type of orthodontic treatment. Preventive treatment basically is where the malocclusion has not even started appearing and the orthodontic treatment is already started. In such cases, obviously, the outcome of the treatment is very good because no permanent changes, no permanent damages taken place. Next is the interceptive orthodontics. Here, some amount of malocclusion has already started appearing and at this stage, the treatment is begun. So we are intercepting the development of malocclusion. Third is the corrective orthodontics. Over here, the malocclusion has completely occurred and now the complete treatment has to take place. So corrective orthodontics becomes more difficult. So what's the rationale behind undergoing orthodontic treatment? What is the aim of orthodontic treatment? This can be best explained by Jackson Triad. It consists of 3 units, EH, aesthetic harmony, FE, functional efficiency, and SB, structural balance. Let's discuss each in detail. We'll start with aesthetic harmony because that's the most common reason why patient comes for an orthodontic treatment. Second is functional efficiency. This is the second most common why a patient wants treatment. And last is structural balance. Let's discuss the example. So, improvement in aesthetics is an obvious reason to undergo orthodontic treatment. This improves a person's self-esteem and self-confidence. This in turn improves the way society perceives the individual. It improves the societal status of the individual, improves his professional life and personal life directly and indirectly. That's the first reason to undergo orthodontics, and that's also the result, positive influence of undergoing orthodontic treatment, improved aesthetics. Second is function. The stomatograntic system has multiple functions. The most important is ability to chew food and speech. If a person has mild to moderate amount of malocclusion, his ability to chew food is not affected and even speech as such is not affected. So these are not really major reasons to undergo orthodontic treatment in most patients. But in some individuals, the malocclusion is so severe that yes, orthodontic treatment may help improve chew food better and speak better. For example, patient with anterior open bite, will not be able to incise food properly with his anteriors. Such patient will definitely benefit from orthodontic treatment. Another example would be patients with increased anterior overjet, excessive overjet, or patients with anterior open bite again may experience amount of lisping. So this is again one example where orthodontic treatment can help improve the speech and function of the stomatognathing system. So let's go to the last feature. Last being the structural balance. Now, when it comes to structural balance, try to think of the periodontium and the teeth as a unit, its structure. If a patient has extreme crowding, say of mandibular premolar region, and the mandibular premolars are jetting out due to crowding on the buccal aspect, this results in thinning of the alveolar plate and hence makes it susceptible to gingival recession. So this is one example where undergoing orthodontic treatment will help maintain the integrity and balance of the structure and prevent the breakdown of the structure. Another example would be patient with excessive overjet. Such a patient with increased overjet and proclining and jetting out maxillary incisors, they have a higher risk of experiencing incisor fracture. Although studies suggest that it is not statistically significant, but to some extent the person becomes susceptible to maxillary incisor fracture. So this is another example where structural balance can be maintained. So there we go. That's the Jackson Triad: functional efficiency, aesthetic harmony, and structural balance. That's all for today. Thank you for watching. So if you're interested in learning more of orthodontics in simplified terms, please like and subscribe my channel. And if you have any doubts or suggestions, please drop them in the comment section below. See you next time.